Rectocele surgery. Introduction. The fascia and the muscles of the vagina prevent the rectum from pushing into the vagina. Select true or false. Correct. The fascia is an area of tissue between the posterior part of the vagina and the rectum. Muscle straining during childbirth can cause a rectocele. Select true or false. Correct. All rectoceles require surgery. Select true or false. Correct. Mild grade 1 rectoceles may not require surgery. Your healthcare provider may recommend avoiding heavy lifting, doing Kegel exercises, or using a pessary. You will have a urinary catheter for a period of time after the rectocele operation. Select true or false. Correct. You will have a Foley catheter for a week or two after the operation. Are heart attacks and other anesthesia-related complications common during and after this operation? Select yes or no. Correct. Anesthesia is safe, but the older you are and the more medical problems you have had, the higher the risks. You should tell your anesthesiologist about any medical problems you have had in the past, such as heart attacks and lung problems. Are infections common after surgery? Select yes or no. Correct. Infections are not common and serious infections are rare. Even though infections are rare, they may still happen. After a successful rectocele procedure, there is a risk that the rectocele may recur. Select true or false. Correct. Thank you for using Explain.